Okay, ready to dive into something kinda hidden?
Hidden but powerful.
We're talking body fluids those samples doctors take. They're more than just gross, right?
Oh, way more. Each one's like a liquid report on what's happening inside you, and labs have gotten insanely good at reading them.
I remember cerebrospinal fluid, the brain protector, from bioclass. What else is there?
Synovial fluid keeps your joints moving smoothly. Even the fluid around a fetus, amniotic fluid.
Each with its own story. So today's mission, uncover those stories. How do these fluids help diagnose stuff, treat stuff?
Exactly. From simple looks to high-tech gene tests, we'll see how they pinpoint problems and guide doctors to the best treatments.
Detective hats on then. Where do we even start with all this fluid stuff?
Let's kick it off with serous fluids.
Serious.
Yeah, think like the stuff around your heart, lungs, and your belly. Peritoneal, pleural, pericardial, they're cushions and lubricants, crucial for protecting organs.
Like the body's built-in shock absorbers. But what if things go wrong in those spaces? How do fluids help then?
Sometimes you get fluid buildup. It's called an effusion. Analyzing that fluid becomes key. Imagine someone comes in, can't breathe well, chest pains. Doctors thinking pleural effusion.
Meaning fluid around the lungs. But why? Infection. Heart's acting up. Got to narrow it down.
That's where the serous fluid analysis shines. First thing, they look at it, is it clear, cloudy, bloody? Appearance alone tells a lot.
Cloudy's bad news, right?
Usually means infection, clear, maybe heart failure. But it goes deeper. They check cell counts, protein levels.
Right, because the type of cells, the amount of protein, those hint at what's up, don't they?
Spot on. Helps distinguish between transudates and exudates.
Well.
Transudates think leaky water, pressure imbalances, like with heart or liver problems. Exudates are the action-packed ones. Tons of cells, proteins, inflammations going on.
So one's a calm lake, the other's a raging river. Doctors need to know which is which. But how? Secret formula.
Kind of. They use Light's criteria, comparing protein, enzymes in the fluid, to what's in your blood. Tells them if it's pressure pushing fluid out or something irritating the cavity, causing that inflammation.
So much info from a little sample. It's like they're cracking a code.
It is. And this is just serious fluids. Infections, cancers, autoimmune stuff, they play a role in diagnosing a lot.
Color me impressed. But the brain? It's so delicate. How do they even peek in there?
They have a window, cerebrospinal fluid, or CSF, cushions the brain, feeds it, all that good stuff.
The brain spa and bodyguard rolled into one. But getting to that fluid sounds intense.
You're thinking lumbar puncture. Spinal tap? Yeah, it's a thing, but it's routine. Needle between the lower backbones, sample collected.
So they're tapping right into that brain-bathing fluid. What can they even learn from it?
Tons. Meningitis, for one, that's inflammation of the membranes around the brain, spinal cord. They can see bleeding too, hemorrhage, red blood cells will show up.
So wicked headache, fever, stiff neck, spinal tap could rule out meningitis.
You bet. And that's not all. Neurological stuff, like multiple sclerosis. CSF can hint at that too.
Wow, the brain's secrets right there in the fluid. Any other special things they look for?
They can test for a protein called beta-2 transferrin, only found in CSF. So if it's leaking out after a head injury or surgery, they'll catch it.
Like a brain leak detector. Pretty smart. Okay, we've done serous fluids, brain juice. Now, what about synovial fluid, the joint stuff? Tell me about that slippery goodness.
Synovial fluid, your joint's unsung hero. Keeps them moving smooth, prevents wear and tear. WD-40 of the body.
Nice analogy. So creaky knees mean I'm low on this stuff.
Not necessarily. Age does its thing, sure. But synovial fluid analysis, it's more about diagnosing joint problems specifically.
Arthritis, right? Because there's like a million types, different causes.
You got it. The fluid can tell them apart. Osteoarthritis, the wear and tear kind, you might see cartilage breakdown in the fluid.
And something like rheumatoid arthritis, the immune system's going haywire.
That'll show up differently. Inflammation markers, white blood cells in the fluid, that kind of thing.
Like comparing a rusty hinge to a swollen joint. Analysis helps pinpoint the issue. But how do they even get this fluid? Sounds tricky.
It takes a steady hand, but it's common arthrocentesis. Needle in the joint, draw out a bit of fluid.
Then under the microscope, it goes inflammation, infection, even crystals, right?
Exactly. Gout, that inflammatory arthritis, they'd be looking for uric acid crystals. Tiny needles under the microscope.
Ouch. Good to know they can at least confirm it and treat it, right?
Absolutely. That's the beauty of this whole thing. We're looking at cells, getting specific, treating the actual problem.
We've done serious fluids, CSF, now joint juice, each with its own story. But let's switch gears. Reproductive health, now semen analysis. What's at the role in the whole baby-making puzzle.
It's a cornerstone for male infertility, one of the first tests they do when couples are struggling.
Makes sense. Gotta look at both sides, right?
For sure. And with semen, it's not just counting sperm. Volume, how well they swim, their shape, even if there's white blood cells, could be an infection.
Like a sperm obstacle course, only the best make it. But seriously, how do they analyze all that?
Microscopes, special stains, even computers tracking movement.
Fancy.
Yeah.
And genes, can they see anything about that in semen?
Absolutely. There's tests for Y chromosome microdeletions, missing bits of DNA that can cause infertility.
Wow, so they're looking at the sperm's blueprint? That's wild. Speaking of sperm going astray, what about post-ejaculate urinalysis? That sounds different.
It is, but it's how they diagnose retrograde ejaculation, semen going backwards into the bladder.
Got to make sure everything's flowing the right way.
Okay.
Okay, starting to see how these fluids, even the kind of personal ones, are super informative.
And it's all about getting answers, right? Starting families, managing health. Now, vaginal fluid, crucial for a healthy environment down there. But when things go wrong...
Yeast infections, bacterial vaginosis, those are no joke, discomfort-wise. How do they tell them apart with lab tests?
Vaginal fluid analysis, pretty straightforward. They check pH first, how acidic it is. High pH might be bacterial vaginosis, lower, more likely a yeast thing.
Like checking the soil for your plants. Different pH for different needs. But don't they need to see the actual bacteria or yeast?
You bet. Sample under the microscope. Yeast cells for a yeast infection. Clue cells for bacterial vaginosis. It's a specific pattern of bacteria.
Microbial. Where's Waldo? Gotta find the culprit. But what if they're hiding?
Then they bring in the cultures, grow the vaginal fluid, see what bugs thrive. Helps ID the specific cause, especially if it's unusual.
Little spa day for the microbes. So they find it, then they can treat it properly. Targeted therapy, right?
Exactly. Right weapon for the right enemy. Okay, we've done semen, vaginal fluid. Now, amniotic fluid, the baby's swimming pool. I know it protects the fetus, but analyzing it, what can they learn? Oh, amniotic fluid analysis, often from amniocentesis, is a goldmine for fetal health. Chromosomal analysis, that's the big one. Down syndrome, other genetic stuff.
When getting a sneak peek at the baby's genes, isn't amniocentesis risky, though?
Some risk, yeah, but it's small. Usually reserved for when there's higher chances of problems, like if mom's older or family history of genetic stuff.
So a careful decision, weighing the pros and cons. Anything else they look for besides chromosomes?
Yep, alpha-fetoprotein levels that can show neural tube defects, like spina bifida. And they check if baby's lungs are mature enough in case of early arrival.
A prenatal checkup, right there in the fluid. Wow. Amniotic fluid tells us about present and future health.
Exactly. It highlights how analyzing these fluids can guide all sorts of decisions, get the best outcomes.
Okay, we've done a lot. Serous fluids, CSF, joint stuff, even reproductive fluids.
Yeah.
Each with its own story, and labs are the storytellers. But we're not done. One more fluid to explore.
Yep, can't forget about the lungs. Bronchoalveolar lavage fluid, BAL fluid for short.
Ooh, the lungs. What kind of secrets do they hold? How do they even get this BAL fluid?
They put fluid in, then take it back out through a bronchoscope, that thin tube they snake down your throat.
Fancy tech. And what's the point of analyzing it?
Diagnosing lung stuff, infections, those interstitial lung diseases, even cancers.
So, looking for the root of lung problems. How do they do that with fluid?
They look at what cells are in it. Eosinophils high. Maybe allergies or a specific lung disease. Lymphocytes high. Could be hypersensitivity pneumonitis.
Different cells, different story. Amazing.
And it lets doctors treat the right problem, crucial for lung stuff.
I am blown away by this whole body fluid thing. Each one's a window, and the lab analysis is the key to unlock it. They're whispering secrets about our health, aren't they?
You got it. And those secrets lead to accurate diagnoses, the right treatments, better health for everyone.
Phew, I need a breather. Part one down, but there's more to come.
Definitely. We'll look at what drives those testing decisions and how these fluids might even hold clues to diseases we haven't discovered yet. Buckle up.
Welcome back. Round 2, fluid fans.
Ready for more. It's crazy how much these fluids can tell us, huh?
Totally. This time, let's get practical. What makes doctors choose to analyze certain fluids? How often and why?
So it's not just about the fluids themselves, but how they're actually USED, right?
Yep. Like a puzzle, gotta have all the pieces to see the full picture. Lay it on me. What are these puzzle pieces? What drives those testing decisions?
First off, how easy is it to get the fluid? Some are way simpler than others. Blood draw, piece of cake, cerebrospinal fluid. Needs a lumbar puncture, way more intense.
Yeah, no spinal taps for every headache. So Less invasive is better if it gives the info, right?
For sure. Always weighing the benefits against the risks and how much it bugs the patient.
Accessibility, check. What else?
How much useful info does the test give? Some fluids are info gold mines, others gotta dig deeper, more specialized tests, expensive stuff.
Right tool for the right job. Don't need a sledgehammer to crack a nut.
Exactly. A simple P-test, urinalysis, that's a multi-tool. UTIs, kidney issues, great for screening. But amniotic fluid, looking for genetic stuff, that's high-tech, pricey. Gotta choose wisely, get the most bang for your buck, info-wise.
Okay, accessibility, bang for the buck. Anything else on the doctor's mind when ordering these tests?
Patient comfort, huge one. Some procedures are just plain unpleasant. Gotta minimize that whenever possible.
Totally. No one wants to go through something rough if they don't absolutely have to. So balancing benefit with how uncomfortable it is.
Exactly. Gotta find that sweet spot, get the info, but keep the patient happy.
Accessibility, good info, patient's got to be on board. What else goes into the decision?
How common is the problem this fluid might diagnose? If it's super rare, testing everyone doesn't make sense. Gotta focus where it matters most.
So if only a tiny handful of people get it, probably not worth screening everyone. But common stuff like UTIs, yeah, test away.
You got it. Use resources wisely. Target the testing where it'll actually make a difference.
Makes sense. It's more than just, here's some fluid, what's wrong?
Doctors
Are thinking about all these things when they decide.
It's a whole algorithm, constantly changing as we learn more, get better tech.
Speaking of learning more, this has been bugging me. We're talking about diagnosing what we know. But could these fluids hold clues to diseases we haven't discovered yet?
Now that's a thought. Reading the future in these liquid fingerprints, maybe.
Okay, I'm hooked. Tell me more.
Imagine this. We're looking at blood, and some protein's a bit off. Don't know why yet, but it's weird. Years later, bam! That weirdness was an early sign of some brand new disease.
Health crystal ball.
No.
But how W? What clues would they even be looking for?
That's where the cool science comes in. New ways to analyze the stuff, tiny changes, hidden messages in their DNA.
Those whispers, those tiny things that might mean something big later.
Exactly. And this stuff could change everything. Early detection becomes the norm, stopping disease before it starts, treating it when it's easiest.
Sign me up for that future. But back to now. We talked about serious fluids, CSF, joint stuff, even the reproductive ones. BL fluid, though, the lung one. The lungs are complex, right?
Oh, totally. Airway mazes, blood vessels everywhere, working nonstop. BL fluid analysis gives us a peek inside that whole system.
Like seeing our breathing in action. What can they diagnose with this fluid?
Oh, tons. Pneumonia, tuberculosis, those are infections. Sarcoidosis, hypersensitivity, pneumonitis, inflammatory stuff. Lung cancers even, and how meds are affecting things.
Wow, all that from some lung juice. But how do they even make sense of it all?
Cell populations, that's key. Lots of neutrophils. Bacterial infections likely. Lymphocytes up. Maybe a virus or some inflammation going on. It's like looking at the immune system's army, seeing who's been sent to fight.
Not just individual cells, but the whole army's composition tells the story of the battle in the lungs.
Exactly, and it gets cooler. They can look for specific markers, proteins, enzymes, gives them even more clues.
So it's cell counts PLUS, these markers, like a multi-pronged investigation to really figure out the lungs.
You got it. Forensic science, but for lung health. Cells, proteins, the whole shebang, leading to better diagnosis, better treatment.
BL fluid, you impress me. Like a magnifying glass for our lungs.
It's a powerful tool, and it's only getting better. More research, more specific stuff they can look for, all to help us breathe easier.
It's amazing what we can learn the deeper we dig into these fluids.
For sure. It's about pushing the boundaries of knowledge, all to improve people's lives.
Speaking of pushing boundaries, earlier we were talking about these fluids maybe showing signs of diseases we don't even know about yet. Any examples of how that's being researched now?
Absolutely. Liquid biopsies are a hot topic. Analyzing fluids, mostly blood, for tumor cells, or even bits of tumor DNA that have escaped into the bloodstream.
So instead of cutting out a piece of tissue, they're looking for these rogue cells, DNA fragments just floating around?
Exactly. Way less invasive than a normal biopsy. And potentially catches things earlier because it can see if cancer's spread.
High tech, hide and seek with cancer.
You got it. Could change how we diagnose and treat cancer completely. Imagine catching it super early, when it's easiest to beat, or even tracking how well treatment's working, just by watching those tumor cells or DNA.
Now that's game-changing. So it's not just about what we know these fluids mean, but what they might tell us in the future. Personalized medicine, early detection.
Exactly. Fluid analysis is evolving, leading the way to a healthier future.
Wow, part 2 down, and my mind is blown. Accessibility, new discoveries, even liquid biopsies. It's amazing how much we can learn from these fluids.
Right, and there's still more to come. Next time, we'll dive into some specific examples how these fluids help diagnose and treat particular conditions. Plus, we'll talk about some of the ethical stuff that comes with these tests. Stay tuned.
Final round. We've talked accessibility, future tech, but I want to go back to some specific fluids, like in part 1, CSF, that brain bathing stuff. We said it helps diagnose meningitis, bleeding. What about trickier brain stuff?
Good point. We mentioned Alzheimer's, Parkinson's. Could CSF show early signs of those? That's some cutting-edge research right there.
Yeah, finding those early whispers before the storm hits. What are they even looking for?
Specific proteins. Amyloid beta, tau, those are linked to Alzheimer's. Parkinson's are looking at alpha-synuclein. Tricky thing is, everyone has these proteins in their CSF. It's the levels that matter, how they change. That's what researchers are trying to connect to the disease.
So, high levels, early warning.
Exactly, and early means options. Intervene sooner, slow it down, maybe even stop symptoms completely. Imagine knowing you're at risk way before anything feels wrong.
Wow. More time to plan, more treatment choices, better quality of life for longer. That'd be amazing.
It would, and it all comes back to giving people knowledge, giving them choices. That's what this is all about.
Okay, so CSF's a big deal for brain research. Any other fluids showing promise for early detection?
Definitely. Tears, believe it or not. They're looking at whether tear composition changes could mean certain cancers.
Tears? Seriously? Never
Yeah.
would have thought of that. How does that even work?
Tears have tons of stuff in them, proteins, hormones, even tiny bits of DNA and RNA. And as we learn more, we're seeing that the levels of this stuff change when people have certain diseases, cancer included.
Those little drops are like tiny health reports. What other fluids are on the research radar?
Saliva's a big one. Could help spot heart disease, even predict early labor in pregnant women. Just think, a simple spit test to see if baby's coming early.
That would change prenatal care big time. It's mind-blowing how much these basic fluids can tell us. It's like every fluid in our body has secrets to spill if we know how to listen.
You got it. And as we get better at analyzing them, those secrets mean better health, better lives. Early diagnoses, personalized treatments, it's all happening.
Well, I'm officially a body fluid believer. Deep Dive has been incredible. Never thought I'd say that.
Me neither. It's such a cool field, always changing, always finding new answers.
And to everyone listening, hope you learned something new, and maybe you'll look at your own bodily fluids a little differently now. Until next time, keep those brains curious.